for anybody who might have forgotten Brennan's name or doesn't know him personally, I'll just introduce him as our Bright Talent leader, the founder and CEO of Bright Talent. And just to share with you exactly what Bright Talent does, maybe even beyond what you might know it does, is that we are the resource for strategic HR people, helping HR teams and business leaders solve their people challenges. So Brennan will now take us into the presentation, and we'll begin for you.
Great. I'm going to stop sharing just for a second, just so I can say hello to everybody. Thank you so much for coming. I recognize some names, some new names, so I'm really excited that we are coming together as a community to really talk about this important, really important topic of how are we going to safely and efficiently and effectively bring our workforce back to the workplace. And so just to give context to you, a little over a month ago, as some of the politicians started throwing around dates of when we would like to or when we should plan on returning to the workforce, you know, there was April 30th, there was early May, and that really stopped us, and because we realized, how we left the workplace and how we come back to the workplace is going to look very different. And this is going to require some thinking, some planning, some organizing. In essence, this is a change management project is what we recognized it as. And so me and the team, we sat down and thought, what would we build for our clients? And this is what we want to build for our community so that they have all the tools they need to be organized. Because there's so much information, there's so many different ways to do this. We thought we need the tools on how to do this. And so it's important for me to point out that Mickey Joe is our head of client engagement, Renee Maurer is our head of operations, Amy Watson is head of administration. And really it took a true team effort. We sat down and probably a little over a week pulled together all these tools, which we're going to review with you now. So we're really pleased you're here. And I'm going to turn my screen back on in terms of sharing the PowerPoint and what we've built for you.
Hey, Brennan, before you dive into the presentation, I think everybody here probably knows how Zoom has been changing some of their settings and things a lot. This morning, I don't have as much control for some reason over the settings. So I'd like everybody, I'd like just to let everybody know, please don't use chat today. When you have a question, put it into your Q&A box, because that's the only box that I'm going to be focusing on. And then hopefully I'll either be able to answer you if I'm, for some reason, because of some things are going on with the controls this morning. If we're not able to get to it, we'll be answering all of your questions at the end. So after our guest speaker. So
great.
I just needed to say that. Thanks. Go ahead.
No problem. So here, thank you for that. Yeah, so we personally built this webinar and to be 45 minutes. We're going to start on time, end on time. We wanted to more or less make this as an opportunity to come forward, share the tools that we developed with you, quickly kind of share some assumptions, then get into the Q&A. And during the Q&A, I'm really excited. We have an awesome guest speaker today. And that's what we've been doing. This is a webinar series. So every Friday at 11, we are hosting this webinar. And then we're having different guests as well show up during our Q&A that will cover a specific topic. So we'll get more into that in a minute. So just to set the agenda right now, I'm going to spend 10 seconds talking about us, and then we'll get into the assumptions of what is happening now, you know, more or less as we come out of quarantine, the planning that needs to go into that, the tools that we've developed to help you get organized, and then we'll jump into the Q&A. So I want to set expectations with you. So in short, who we are. So Bright Talent is a boutique HR consultancy. We provide HR experts in project management training, HR advisory when you need them. I was a former HR leader, and so I sat in your seat, and when I needed somebody, that's more or less the resource I was always looking for, so hence I created the business to help other HR leaders. We are a company that lives by our values, so we provide honest solutions, we do what's right, we are resourceful, accountable, and we really believe in community. And that's what this entire webinar series and what the entire initiative is around the roadmap to return to the workplace is about, is giving back to our community that's been so generous with us. So that's who we are. Now, really, let's talk about what we're going to focus on during this webinar. And so here, we're going to cover some assumptions based upon what we know today. And if you heard us chit-chatting before we started, information is changing daily. So we're trying to bring you the most up-to-date data, hence why we are still hosting this webinar on a weekly basis, because the information changes from one week to the next. So we're hopefully sharing with you the latest data. We're going to talk to you about a project plan for how we're going to organize about getting the workforce back into the workplace safely. And we're going to share some collaboration tools with you so that you can build this plan collaborating with business leaders. And then we have some important decision workflows. As you look at your employee base, we have to look at them very differently now in terms of remote versus who's coming back to the workplace. So we will cover that. What's not covered here is LOA, any of the leave of absence policies, any of the emergency acts that are in place, any compliance around those, and any employment law. This is really more around strategy and operations, not so much the compliance or employment law aspect of it. So just to clarify. So here are some assumptions we are working from. So if we're going to return to the workplace, here we are. I've been saying early May looks like the arbitrary target, and we're here, which is just amazing. We have quickly gotten to this place. And I'm sure just like you, I am reading every day of companies that are committing to opening from this point forward, such as Starbucks. I just read that Macy's is going to open all their stores into June. So it is happening. So we're here. And who knows in terms of how many other smaller businesses are making this decision now as well. So we are here. So, but what's important is you need to reference your local health agencies for up-to-date guidance, because what is perhaps at the federal, state, county, and even city level can differ, just like we had in California, where those of us in Orange County were excited to get back to the beach responsibly, yet the governor didn't like it, so he shut down the beaches. I will stop there. And so I don't want to talk anymore about that. But so nonetheless, we need to also prepare for the new workplace. Because here's some other assumptions. We don't know when this pandemic will end or if it'll return. It has definitely exposed gaps for most of us in our workforce plans in terms of how we react and respond to a pandemic. And it's time really to plan for the new reality, because this will usher in change, hence the change management focus for us in this regard. So relating to those assumptions, we need now as HR leaders to consider these 6 things as we're coming back. So first of all, we're going to have to live in a world, at least on the short term, with distancing restrictions, which might require office adjustments. So if you have a office full of cubicles that are literally or open space that are sitting just feet, if not inches from one another, that is something we're going to have to change. Gathering restrictions. So if we have more than, let's say today, I think the gathering restrictions are 10 people. If we have more than 10 people sitting in a room, we're going to have to start thinking about how do we manage that? How are we going to only have 10 in a room that had maybe 100? So how are we going to manage that aspect of it? We're going to have employee health restrictions. So for the foreseeable future, those are in the high risk category that are 65 years or older or immune compromised. How do we handle that employee population? In addition to, we are, as employers now, are in our right to check our employees' health. So what is the most effective way to do that, such as temperature checks, symptom checks, as people walk into the office? How is that being organized? How are we checking that? And there's lots of different ways to think that through, and we'll cover that in a bit. Infection prevention measures, such as new sanitation guidelines, and then what we're going to get into in our Q&A, what is your response plan if one of your employees tests positive for COVID-19? What do you do? And so we need to think about putting an action plan in place. And then in terms of remote workforce policies, a lot of companies, I think upwards to 70% of companies, were not prepared to have a remote workforce, so that all of these people now that are working remotely, we need to catch up with our policies and our practices and maybe even our systems and security to make sure that that is something we could handle long term as an option for our workforce going forward. I'm hearing a lot of news where a lot of companies are now going to offer this as something as a permanent status for employees. So that's something we also have to assume. So we're going to jump into the tools now. We're going to review a project plan. We're going to review some decision workflows, and then we've got a project plan outline which details the project plan even more. And so when we develop this project plan, we've developed it so that it can help you focus on those core tasks that need to be looked at when you're bringing your workforce back. So it's going to be policy, it's going to be communications, it's going to be how you handle these employees by function, what are the system requirements by function, and then what are the facility needs by function. And then, as I mentioned during our chit-chatting with Mickey Joe, we're all building this on the fly, and so it's going to require constant evaluation and modification as we continue to move forward. So we have created, and for those of you that if you're looking at this on a phone, I apologize, some of these are snapshots of files that we created, and so these are downloadable on our website, so you can maybe even print those off in a PDF and review these as we go through this, if these are too tiny for you to see on your phone screen. So this is a MS project document. Let me get back to this. There we go. This is, I'm going to press annotate and grab my little pointer, and I click stop sharing. So sorry about that. This is an MS project plan document that we created. And the next several pages, I'm going to walk you through this document and what it looks like in terms of how we organize the thought. So I just mentioned those 6 areas that we are categorizing in terms of how to prepare. This has now been dropped into the MS project plan. And so if we're looking at the MS project plan, you can see policies here. And so as we're looking, as we start by looking at our policies and preparing to return to the workforce. We're going to first, I'm certain most of you don't have a return to workplace policy. We have a return to work policy, but a return to workplace is different. So this could be a temporary or a new permanent policy. You will want to draft this more or less in bullet point form as simply as possible, just to start developing your plan for how the workforce is going to return to the workplace. And over here, we've left you some information around where to go to check for the different restrictions and things that I was mentioning before. Once you develop that return to workplace policy plan, you will then also be reviewing your return to work policies. So all of us have return to work policies. You will now be overlaying these two to make sure they are more or less aligning with this newer guidance because of the pandemic. And let me be clear, you are doing this as more or less the leader of this project, collaborating with the other departments in your business, such as IT, facilities will be critical, finance. If you are HR at a smaller business and own facilities, I recommend partnering with facility experts, because they're the ones that will know all of the requirements needed as you move your facility around to accommodate these new restrictions. So we're going to start by developing these policies first and collaborating with our fellow colleagues that run different departments to more or less get a draft of a plan. And I say this in every webinar. This is not a time to be perfect. This is not a time to have this beautiful document. This is a time to be crude and effective. So whatever you develop it simply so that it's easy for everybody to read and get right to the meat of what the requirements are. You can always make this a more formalized policy later. This is all right now for getting you back to the workplace, because I'm sure, like many of you feel like I do, I feel like it's nipping at the heels, the time's coming, and so you want to more or less move more quickly than perfectly, and so that's my guidance to you here. And then more or less simultaneously as you're developing that policy, you will also be working on your communications plan. So I'm going to advance the slide, and now I've opened up the communications tasks, so the subtasks underneath the communications task. And so you will now need to start developing a plan for communications. You will want to develop, like right now would be a great time to develop a communication to send out to all employees to let them know you are developing a return to workforce plan. And over the next week or more, you will be continually sending out communications as things progress. And in that way, employees have the information they need. They're not left in the dark, and they're understanding what the next steps are. That might be your first communication that you're going to be sending out. And so when we're developing a communication plan, you need to know who the audience is. So is it all employees, or is it a specific group of employees? What is the message going to be to that group of employees? What is the tool or technology you're using to communicate with employees? In some cases, it might be a printed piece of paper on a bulletin board, something as simple as that. And so it's building that plan out and then crafting the actual message, right? Crafting the message to send to those people, and then the timing. When are you sending these messages? And so it's important to have a communications plan set up so that you're not more or less scrambling to share information. You're just more or less sharing information on the go. And then once you understand all those pieces to the communications, you'll be launching it. And including, as you refine your policies, you will also be potentially, that's part of the communications you'll be sharing with employees. Then as we move down another task to functions and departments, and this is where we start really getting into the meat of it, of the plan, you will need to be thinking of yourself and your own HR department, depending on how many employees you have, as to how you're going to return your employees to the workforce. You're also going to need to be working, again, with those department heads to understand what are their employee requirements, what are their facility requirements, what are their system requirements. So you have to meet with them and start organizing in that fashion. What are the different departments and what are the different needs for that functional department? This way it makes the plan more organized, almost into verticals, so that you can actually go and respond instead of being just one giant response. You actually categorically can respond and partner with those department heads to build the plan to come back. And so moving forward, as I mentioned, then we get into the systems piece. And the systems piece is interesting because those of us that ran into remote workforce and might not have had the right systems, now's the time to reflect on what you need now. There's also talk of some employees that are returning to the workplace, but also working remote. So if we're having a hoteling situation, so some employees might work on site a couple of days a week and the rest remote, what do those system requirements look like, including facility requirements? And so you'll be working closely with IT to identify those needs. And then in terms of facilities, and this is one of the larger, if you can see in advanced, and there's a larger list of subtasks, we really need to understand what are the facility requirements by location. And then inside those locations, we have the individual offices themselves, but we have those communal meeting areas such as conference rooms, kitchens, cafeterias, bathrooms. How are we handling those facilities? Some of you just have a single office. Some of you have multiple locations. And then there's also talk about in terms of how we come into those locations. There might be one door for entry and another door for exit so that we're not crossing paths all the time, again, with those system restrictions. So there's a bit of to think about here, and you're going to be working with your facilities or with facilities experts to help figure that out. And then also, lastly, the janitorial or cleaning regimen, the sanitation. What does that look like now? How often are we cleaning? What is the responsibility of employees? Perhaps now companies are providing, a cleanser or wipes that they can wipe down their phones and things after use before they leave for the day. So there's some new practices we're going to have to put in place as HR leaders. And then lastly, below the last item is that ongoing workforce and review, where as you put this in motion, and again, it doesn't have to be perfect, and you're not failing if it's not entirely clear and employees are learning, and that's all part of change, right? It just takes a little time. You have it's the whole bell curve. You have your early adopters, your folks in the middle, and then your laggers. So you just kind of need to manage around that and learn. So we say every 30 days, 60 days, 90 days. It's probably even faster than that. However, it's something you're just going to continually evaluate. And let me share right now, as I've walked all of you through this, no one is significantly ahead of you or ahead of the game, or everybody's about the same position. We all know a little bit more than the other, and we're all sharing and we're learning how to do this together. So that's what this is about here, is to help us all get organized together. So now I want to talk about workforce decisions. So once we get the plan in place, and once we understand more or less what those requirements will be for a department and facilities and systems, then we really need to think about our employees. And we need to think of them on a macro level and a micro level. So macro level is by function. So by function, how are we going to segment our employee population and prepare for them? And then on the individual employee basis, how are we going to understand how to accommodate them? And so we have built these workflows to help you think this through. I'm kind of a visual person, so I can visually see things, and this is how I need to think things through. And so on a functional or macro level, and again, I apologize for those of you that are on a smaller screen or a phone, and this is downloadable from our website, so you can follow along maybe more easily. But from a functional level, we have to look at our employee population, and then we have to understand who is returning to the workplace. And if they are not returning to the workplace, we're going to call them a remote employee. And then the next question is going to be, is this remote employee on leave or not? And this is an important question because we have a lot of people that even are working remotely that could be on leave because they're caring for someone sick, or maybe it's just impossible for them to work at home because they don't have internet connection. They are the sole caretaker for their children that are home from school. So we need to understand, are they on leave or are they able to work remotely? If they're on leave, then we're returning you back to your leave policy. If they're not on leave and can continue to work, then we're going to understand what do they need. So we'll work down the flow and we'll review our current remote policy, and then do we need to draft or update the policy? And do we need to, is it meeting all the necessary guidelines for all the departments and like systems and things, make those updates, and then we will include those updates, communicate those updates, and then continually evaluate if this is working for everybody that's on remote. So that's the workflow for the remote employee, the remote workforce. As we come back up to the top again and we go return to workplace, and we have the yes category, so those workers, those employees that are returning to the workplace, once again, is that person on leave or not? This is essential. And if they're not on leave and they're able to work in the workplace, we need to make sure we communicate with them or draft all the requirements necessary for them to work in the workplace. And the subtask box over to the right is a lot of the things we communicated about in that project plan, where you're going to be working with your peers in facilities, IT, and such to make sure the requirements are defined, and you're going to lay all out the specifics for those employees returning to the workplace. We do provide you a tip here below. Really now, when we think of workplace supplies, we have to include gloves and masks and sanitizers for our employees as they come to the workplace. Whether that's a requirement or not, my suggestion is, I believe you're going to make your employees feel safer if you offer those things to them so that it's their personal responsibility or their personal option if they want to use those or not. And it's up to the company, too, to require whether they want to have all employees use that or not. And then once we have the requirements drafted, then we're going to educate the employees on these temporary requirements or whether they're permanent and changing. And then once again, on an ongoing level, we're going to evaluate this just to make sure this works, and we would come back up here and again, just kind of start the process, the workflow again. So that's at the functional level, working with the functional heads to understand how their employees are being segmented out and how you're going to manage them. And then coming to the next workflow, this is on the employee level. And so on the employee level, we start with employee and then ask that same question, are they able to work? If no, then obviously we're going to your company leave policy. If yes, then they are coming back, then they're coming to the next question. If they're able to work, are they now able to return to the workplace? So if the answer is yes, then we work through the same workflow that we just went through on the functional level. If they're not able to come back to the workplace, then the question is, are they working remotely? And if the answer is yes, then we work through the similar workflow that we just saw in the functional workflow. However, if the answer is no, they're not returning to the workplace and they're not working remotely, then we have our first big decision: evaluate the employee's status. If we want to retain them, then we need to go and evaluate what is their current job so that they could potentially work remotely if they're unable to do their job in the workplace. And then for the other employee groups, if they are unable to do their job remotely and they're unable to come to the workplace to work, then we're going to need to change their status. And whatever that status is, whether it's on leave, disability, furlough, whatever decisions need to be made. So that's how you will segment out individual employees so that you stay organized in how you're communicating, as I mentioned, with the different audiences of employees coming forward. So those are the workflows. And then we also developed what we call a project outline. So what this is a Word document, and I'm showing just the top of the first, about a 3-page document that you could find for download. What this does is it goes back and it reiterates everything that I talked about in the project plan, but here we give you actual links to governmental as well as HR-related websites that are going to have all the information you need to develop your policy, to develop your guidelines, to develop your restrictions, and it should give you everything you need in regards to building that plan. And so that, more or less, is the roadmap to return to the workplace. And now we will move to our Q&A. Nikki, Joe, just real quick, let me point out to them, there's some important resources. So all of those links I just showed in the outline, they are also right here. I'm listing them right here. But let me draw attention to our own website, so we're always going to continually update that, as well as we had a guest last week, the CEO of Casco Contractors, their own back to work initiatives from a facilities perspective. And so for those of you that are in charge of facilities, you will want to go to this website because they have a lot of free resources as well for you to help you plan. So with that, let's get into the Q&A, Nikki Jo.
Okay, and before we start the Q&A, did you want to mention anything about Jamie speaking coming up?
Sure. So we're really excited to have Jamie Nelson, who is COO of American West Restaurant Group, which is the 3rd largest Pizza Hut franchisee in the country. And I'll let him share kind of the expanse of how large the business is. However, he is going to be here with us in a minute to share more or less their action plan that they put in place for when an infectious disease breaks out and when an employee tests positive for COVID-19. And he will walk through what they have gone through because they've literally had to go through this. And so for a lot of us that have been working remotely, as we come back, this is one of those experiences we're going to want to learn from. But I think first, Nikki Jo, before we get there with Jamie, are we going to get a couple of questions maybe pertaining to the tools?
Yeah, well,
are we jumping right in?
We're jumping right in to a couple of really good questions. I think one that came across by email and then was posted up by Renee was, what should we do if an employee discloses that they have been in close contact with a person who tested positive for COVID-19? How do we handle that situation?
Right, I had to put my readers on because there is guidance here from the CDC. So if you are in close contact with somebody that tests positive with COVID-19, as long as that employee is asymptomatic, and let me actually just read it before I get, so according to CDC, essential employees who have had close contact with a person diagnosed with COVID may continue to work, so the person that's been exposed, not the person obviously testing positive, may continue to work. However, they have to be checked frequently for any symptoms, as well as wear PPE in terms of masks and gloves and such. And I'll let Jamie probably talk to that as well as we get into this.
Yeah, okay. Here's a great question. Do you have any guidelines pertaining to visitors?
Personally, we have not developed any guidelines for clients pertaining to visitors. However, it's going to be very similar to your employees, at least at this stage in the game, so that if you're visitors that are coming on site, they will be treated no different than an employee at this stage in terms of temperature check. And I guess it depends on your office and where you are meeting that person and where are they going to be in the office space. So we have to use some common sense here.
Yeah, I'm just going to add to that I think it's perfectly reasonable. And sometimes, you know, we don't have laws or federal or even state guidelines for this, but it's perfectly reasonable to come up with a policy, excuse me, that you would like to present to vendors and sometimes even clients in not only social distancing if you have to be in the same proximity, but also some, you know, recommended suggestions about masks and gloves and various things for safety. So even a policy of recommendations for the people that you're working with outside of your own office might add to the safety of your culture. So
excellent.
And then the last one before we go to Jamie is, when we're calling employees to work, do we need to have the employees complete new hire paperwork? So I'm assuming they're talking about people who haven't been working or are on furlough or something like that.
Right, and this is very more back to our standard practices, but it's a relevant question because it's a little bit up in the air right now. If they've not been separated from your business, then you should not have to create new hire paperwork. However, if you separate them entirely, then yes, you would need to treat them like a new hire to bring them back in.
Great. And then just want to mention one more time for those who are wondering that there is a resource page on brighttalent.com that you can get these resources. You'll be able to get the slides and watch the videos over again. So even if you have, you want to just listen to the guest speaker, you can fast forward if you've seen the entire presentation and go to listen to the guest speaker. So with that, let's go into the guest speaker. Go ahead, Brennan.
Awesome. So I think you're going to unmute Jamie, and then I'll have a chance to reintroduce him. Jamie, I can't see you, but are you there? He's still muted.
I'm trying to unmute him.
Maybe he's both muting and unmuting. There you go.
Try that one. Great.
I think I just unmuted myself. Can you hear me okay?
Yes.
Yep, we can hear you perfectly. So Jamie, thank you so much for joining us. We really appreciate you coming out and sharing with us. Maybe we'll just start, Jamie, give us an idea of the size of your business and then maybe share with us, I think what really kind of got me very interested in learning from you is the action plan that Pizza Hut has put in place. So maybe share a little bit kind of the scope of your responsibilities and size of your business, and maybe then talk about that action plan they've put in place as you've actually experienced employees test positive for COVID-19.
Yeah, absolutely. Good afternoon, and thank you for allowing me to speak with the team today. Thanks to Brennan, Renee, Mickey, Joe, and the Bright Talent team. My business may or may not be the same type of your business. However, I feel that what I share with you today will be applicable in one or multiple ways in your business. So we're definitely in the middle of a pandemic that we've never seen before, and it will forever change the landscape and how we conduct business, no matter what business type we have, and how we go about our lives every single day. It's very unfortunate right now that the unemployment rate in America is growing closer and closer to 10%. However, there are still very many essential businesses out there that are supplying a great need and service to our communities. And I really hope that more businesses are able to open very soon. I'm very fortunate in my position here. I'm fortunate to be the COO of one of these essential businesses. You know, we call ourselves the pizza guys. We always have been, and we always will be. Our company consists of 286 Pizza Huts in the state of California and Utah. We have over 5,000 team members, and they're working on the front line daily, and they're literally putting themselves at a greater risk than most folks for contacting COVID-19. And we may not be nurses or doctors or ERs, persons working at the ERs. However, we continue to provide that comfort food that millions of Americans rely on a daily basis. And yes, we do donate meals to those frontline doctors and nurses at hospitals and emergency centers and such throughout our communities every single day of the week. And we're proud and we're happy to do that. Well, I'll tell you, the week of March 9th, it changed the manner in which we will operate forever in many businesses across the landscape of America. What we did is we just quickly engaged with our leadership team and our franchisor, and along with that, we had guidance from an infectious disease specialist to implement specific protocol for the varying situations that were going to be unleashed upon us in a very short period of time. Obviously, the number one priority in all of that is keeping our team members and keeping our guests safe and out of the path of COVID-19. Now, very quickly in our restaurants, we initiated this 6-foot social distancing standard. So even though it may seem difficult to operate inside of or outside of 6 feet in the restaurant, we do so as best we can, and we do a pretty good job of that. We immediately shut our dining rooms down. And then we also offered contactless transactions for carryout and delivery occasions to all of our customers within a week. We also immediately started working with our suppliers to secure future increased needs for items such as disinfectants, soaps, and sanitizing products. Obviously, the need for disposable gloves has more than tripled, and the necessity of masks that are now mandated in and about the workplace and just being out in public in nearly every county in the state. And we also secured plexiglass shields that we put between our employees and our customers to prevent any kind of spread of COVID through sneezing, coughing, or the such. Additionally, in our restaurants, we mandated the 3 questions we ask each one of them daily. Number 1, do you have a cough? Number 2, are you experiencing any shortness of breath? And number 3, do you have a fever? And our guideline that we put in place for fever is at 100.4 degrees. And if they say yes to any of those, we simply ask them to stay at home. They can't work that day. If you're sick, stay home. And next week in our business, we've ordered thermometers. They do not touch the skin or the forehead. You shoot at the forehead and it takes temperature. And we're going to begin testing the temperature of all team members before they begin their shift. So all of this we put in place. However, the single most important standard that we put in place was our action plan for not if, but when we have a confirmed COVID-19 employee in one of our restaurants. And this is just kind of where, the rubber hits the road here. This is when it goes from concern to sometimes critical state in a restaurant, potentially, or any business type. There's really 3 types of scenarios here. You have your symptomatic employees, you have your exposed employees, and then you also have your confirmed employees. And when you have when you have a symptomatic employee, so someone that has a fever of 100.4 or above, or a cough or a shortness of breath, what we do is we remove the team member from the schedule until number 1, they provide a written medical release from a physician, or that team member is asymptomatic for a minimum of 3 days without suppression, meaning they're not taking Tylenol to cut the fever, and they have at least 7 days between, there's been 7 days since the symptoms first appeared. So just to be clear on that, They must be asymptomatic for a minimum of 3 days without suppression, and at least 7 days have passed since the symptoms first appeared. And we encourage them to get tested. However, we can't mandate that they do so. The second area there is the exposed team member. So we define an exposed team member as someone that has had close contact with someone who is confirmed for COVID-19. And remember, this isn't just close contact with an employee. This can be in close contact with a confirmed COVID-19 family member or a friend. And when they are in close contact with them, we remove them from the schedule immediately until they either provide a written medical release from a physician or the team member has been asymptomatic for a minimum of 14 days when they told us that they were in contact with a confirmed COVID-19 individual.
Jamie, let me ask you a question. So I'm hearing the 3 days, the 7 days, the 14 days.
Sure.
How do you collect that information? What's your process for benchmarking any of that information?
Well, the way we collect it and the way we handle that is we've got a COVID-19 a group in our organization that everyone knows what they're in charge of. And in this case, our HR persons, they keep track of every employee that has either been symptomatic, exposed, or confirmed. And we have the date and the time frame to which we were notified of either being symptomatic, exposed, and or tested positive. And we go by the date that they have given us. In some cases with a positive test, we go by the date of when that test was taken, not when it was confirmed positive, but when the test was taken, because there can be some time frame between when the test was taken and when the actual results have been released.
Good point. Thanks.
Sure. So exposed, and Brennan, I think you had mentioned it earlier in the presentation today. There can be a lot of confusion around exposed team members. And what we focus on is an exposed team member to a confirmed person. So we do not find that someone that is exposed to an exposed person as being as a greater risk as someone that is exposed to a confirmed. Because quite honestly, if you're exposed to someone that has COVID-19, it doesn't mean you have COVID. There may or may not be a great chance that you get it. But someone that is exposed to a person that has been exposed is definitely at much of a lesser risk than one that's been exposed to a confirmed person. Hopefully that was clear.
So it's almost a third degree. It's almost like a third degree level, you're saying.
Exactly. So someone that we have that was exposed to an exposed person, we just make sure that we're daily asking them the 3 questions. Do you have a cough? Are you experiencing shortness of breath? Do you have a fever? If it's a no, then we will allow them to continue to work. Now, the most difficult scenario is when you have a confirmed next step. Okay. So the team member, notifies us, hey, I've been confirmed. I confirmed positive COVID-19. And on a few occasions, we've had some difficulty in getting the actual written confirmation back from either the hospital or the doctor's office or whomever they got the confirmation from. But if we have a team member that's coming to us and saying, I tested positive, but I just don't have that documentation right now, we take their word for it, because I do not want to put people at risk in our workplace. So if someone does test positive, that team member must remain off work until recovered, and they must provide a written medical release, which will include 2 consecutive negative tests that are done at least 24 hours apart, or the team member is asymptomatic for at least 3 days without suppression, and at least 7 days have passed since the symptoms first appeared. And I'll repeat that. They remain off work until they provide written medical release, which will include 2 consecutive negative tests that are done 24 hours apart, or the team member is asymptomatic for at least a minimum of 3 days without suppression, and at least 7 days have passed since symptoms first appeared. And we have adjusted this action plan on that last part a couple times over the last 7 weeks. And that is just taking guidance from the CDC as well as our infectious disease consultant, et cetera. The biggest step.
So Jamie,
yeah.
So go ahead. Sorry, I didn't mean to stop you there.
Well, I was just getting into what the next step is. When we have a confirmed case, the next thing we do is we close the restaurant immediately. We inform our quality assurance team. We inform local health departments. We get on an immediate call with myself, the other leads of our departments, and we put our action plan in place on closing the restaurant down. It's throwing out all the food that is open. It's turning off the phones, the internet. It's posting language in the front of the restaurants, informing our customers that we are closed at this time. And it's a very religious process. Unfortunately, we've had to do this 9 times due to employees testing positive. And we've had stores closed for as little as 3 days and some up to 2 weeks, with the last store being 2 weeks, just because it wiped out all but 1 team member of our entire team. So
wow.
Yeah, I mean, when we close down, the most important thing is we stick to our action plan in order to get our business open again as quickly as possible, with sufficient personnel to still operate it and make sure we're doing so in a safe environment. And there's a lot of specifics we follow, which includes thorough disinfecting and sanitizing of the restaurant, with certain days and gaps between before we can open. So the earliest that we will even look at reopening is 3 days. And there's a lot of work being done in those 3 days as well.
Jamie, this is a wealth of information, and I'm so grateful you had a chance to join us and give us that detailed look into Pizza Hut, who, thank you for reminding us, have been operating through all of this and putting their employees at risk for people like me that eat pizza as comfort in times like this.
Yeah.
And the fact that you've had to go through this 9 times is quite extraordinary. And so everything you're providing for me, as well as probably a lot of people watching this webinar, this is all new. And, we appreciate you sharing, and you're ahead of us by that many times in terms of how many times you've had to handle this. So I'm so grateful. I want to be sensitive to our time, but Mickey, Joe, do we have any questions for Jamie from the group?
We just have one that was put in earlier when he was talking, so perhaps it's answered already, but it's just, do we need to do temp checks, or is it optional? And I'm feeling like Jamie covered that.
Yes.
Is there anything else you want to say about that, Jamie?
Yeah, it's optional. It's not mandated by any local authorities that I'm currently aware of. However, that could change, especially with the reopening of all of the dine-in restaurants that are completely closed right now. It's really at the discretion of the company to which you employ. So, yeah.
Thank you.
Yeah, and I think what's important. Go ahead, Mickey Joe. Sorry.
Oh, I just wanted to say there's several people that have written thank you to you, Jamie, and just saying they're just an appreciation for your strategic planning.
Well, it's my pleasure to share with you today.
And Jamie, I would say probably that action plan, these are guidance that they can go and find on. I will advise everybody, check out OSHA. OSHA actually has a really good playbook for returning back to the workplace. So I do recommend going to OSHA as well as the CDC. we'll probably have guidance for what to do when somebody tests positive, so that you can also develop a similar action plan to what Pizza Hut has done for their operations. So I'm going to move forward one more slide just to share with all of you. Thank you for all joining. Thank you, Jamie. Really appreciate all that great insight. All of these tools that we walk through and all these resources on our website, they are all PDF files, but they've been written in MS Project, MS Visio, as well as MS Word. If you actually want copies of the actual files in that software, simply email us or contact us through our website, through our contact form, and we can give you those actual files to help you build your plan. And by the way, all these files are files that we have developed for our clients. If you need help with developing any type of plan, we have developed some really affordable consulting packages for you so that we can help you build them as quickly as needed. So thank you, everybody, today for attending. Mickey Jo, were you going to have one more comment?
No, thank you.
Oh, all right. Awesome. Well, everybody have a great rest of week and a great weekend. And just to remind you, we're going to be back here next Friday with a new guest during the Q&A. Highly likely we'll bring an employment attorney in so we can start talking about ADA, EEOC, as well as HIPAA guidelines when we're starting to become health checkers at work, which we weren't necessarily designed to do. So everybody have a great weekend and stay healthy. Thank you.
Have a great day, everyone. Bye.